Hello listeners, welcome to Views on Health. Back with us in the program is Dr. Kelum Jayasinghe, consultant gynecological oncologist from the teaching hospital Mahamodara in Galle. Welcome back to SLBC, Doctor. Pleasure to have you with us on the program.
Thank you, Fatima, for inviting me for the program again. And today we are focusing on the female gynecological cancers, mainly about the womb cancers.
So is a womb cancer a common feature in women?
It's really becoming a leading cause, a leading cancer among females. For example, in developed countries, it is most common gynecological malignancy in female. One reason is our increased obesity, because the womb cancer has about 30 to 40% risk with obesity. When the population becoming obese, with more and more obese, the womb cancer risk also goes up. On the other hand, the rise of non-communicable diseases in the world, also diabetes, hypertension also has a link with womb cancer. Therefore, in near future, I'm sure that womb cancer will become the commonest gynecological malignancy in Sri Lanka also, because it is rising and coming near to the cervical cancer now. Our cervical cancer incident last year about 1,400 cases, but womb cancer about 1,200 cases, very close now.
Thank you, Doctor. So it's going to be a common feature, and then it's going to affect women more and more. And right now, in the current situation, what is the age group that you see this condition as most common?
Yeah. Womb cancer commonly occur in females which are postmenopausal. About 70% of womb cancer affect to a female who are postmenopausal. And 20% can affect to female which are perimenopausal. That means they are very close to their menopause, but still they are not menopaused. And about 5% of womb cancer can affect to a female who are less than 40 years of age. But we are seeing females not only in their 40s, in their 20s, even 30s with womb cancer now. One reason may be that diabetes, hypertension and obesity is increasing. And other reason, family history. 10 to 15% of cancers are linked to the family history. That means if the family having breast cancer, if the family having bowel cancer, they have a close link with the womb cancer also, which is called Lynch syndrome, where the bowel cancer, the gene is called hereditary non-polyposis coli syndrome, where they have tendency to have bowel cancer. At the same time, they can be presenting cancer, can be the womb cancer also. Those kind of families, the womb cancer present very early. And on the other hand, the womb cancer always we can detect early. If our public or the general population is aware about the symptom, because it causes alteration of your periods, of the pattern of the periods. Usually, as I told earlier, it's a postmenopausal ladies presenting with the cancer commonly. They present with bleeding, which is called postmenopausal bleeding. The problem in our country, they are very shy to come up with that symptom. They wait months and months with the bleeding, initially bit spotting, then later become heavier. But they come to a level where the symptom is becoming more severe. They don't present at the first instant. If they present at the first instant, it's very easy. Doing an ultrasound scan or the transvaginal scan, we can assess the thickness of the endometrium as well as the regularity of the endometrium. Then if the thickness is high, there's a chance of 10% chance to have a cancer. Then we need to do endometrial sampling, that means taking a small part as a biopsy to assess under the microscope to see whether there is due to hyperplasia, that means abnormal growth of the endometrium, or it is due to a cancer. Then whatever it is, we need to treat early. If it is very early stage of womb cancer, then we can do keyhole surgeries such as laparoscopic surgeries to remove the womb as ovaries, as well as sometimes if needed lymph node dissection. That means removal of pelvic lymph node also can be done through the keyhole surgery. And I think that is the way forward, because all the other countries and everywhere the general recommendation for the womb cancer is to go with keyhole surgeries, right? And the other thing about the womb cancer, if the patients are perimenopausal, they present with abnormal uterine bleeding. That means they sometimes presented with intermenstrual bleeding. That means bleeding in between their periods. As well as sometimes the abnormality may be the duration of their bleeding. Sometimes may be heavy bleeding. Sometimes may be irregular bleeding. If they are having those kind of symptoms, they better to go and check themselves with a VOG. Then they will assess if needed the endometrium and do the needful for you. Especially people which are having ovulatory dysfunction such as polycystic ovarian syndrome, they tend to not to ovulate for months and months, which is called amenorrhea. If they are having no periods for about 3 to 4 months, with the stimulation of the estrogen hormone, their inner lining of the womb tend to overgrow. They continuously grow and grow. Then it can become hyperplasia. That means that overgrowth become uncontrolled sometimes. If the hyperplasia can happen, therefore the people, especially having polycystic ovaries, need to remember they need to get their menses, if they are not coming with spontaneous way, by meeting a doctor, get an artificial menstruation by using medication also, at least every 3 months.
So that is one way of controlling the situation.
Yes.
And on the other hand, doctor, we come back to the fact that now they know this is a post-menopausal condition. Just a question in between, could anybody who is still menstruating have a womb cancer?
Yes, as I told you, yes. Fatima, that about 20% of perimenopause, yes. That means near the age of menopause also.
Yes. That is at that point.
Yeah.
Not earlier.
Early also can happen. About 5% are less than 40 years also, they can get cancer.
So now that we know that sort of situation, there is a 5% that can get it, and then about a 20%.
Yeah, near the menopause.
Yes, and
after menopause, majority 70%.
So, why is it at that stage? Why is it so after menopause?
I can't exactly say this is the firm reason, but it is more common because cancer development in the womb is more common around the postmenopausal age group. Commonly around 60 years of age. It is the commonest age group to get the ovarian cancer. Womb cancer. It's about 60 years of age. And maybe the age as well as the genetic factors also play a role, and the estrogen also has a role also, and I think the more important is the awareness about the symptoms. If you are menopause, then if you're getting bleeding after menopause, or if you are having a vaginal discharge after the menopause, then you need to be vigilant about this. You need to go and seek your help from your GP or the gynecologist and get yourself sorted. That is the most key thing. The other thing is about before menopause. If you are having bleeding irregularities, such as change of frequency, change of duration of bleeding, or in between cycles you are having bleeding also, then you need to get yourself checked. And less than 40 years, especially the ladies who are having polycystic ovarian syndrome can get womb cancers. For them, because they are not ovulating in a proper manner, therefore they have to get their menses at least every 3 to 4 months. If it's not happening spontaneously, they should meet their gynecologist and at least go using medication. Iatrogenic menstruation need to be done every 3 to 4 months.
So this condition is treatable. In the sense, maybe surgery, you might have to remove the womb, but it is treatable, and then with post-surgical treatment, they can be cured of the cancer.
Womb cancer is a very, very, in the sense compared to other cancers, for example, cervical and ovarian cancer, because it's always symptomatic. And bleeding irregularity is the commonest symptom. And other than that, they can have vaginal discharge, as I said so. Because they are symptomatic, patients tend to present early. When they present early, they present with early stage. Usually stage 1 womb cancer can be treated very well with a 5-year survival about more than 95%. That means 95% of ladies who are diagnosed with womb cancer, if treated in stage 1, for 5 years they won't get much of problems. The cancer won't come back for them. Right? Only 5% the cancer can come back. The treatment for the early stage womb cancer, that means stage 1 and stage 2, is a general recommendation is if we can do keyhole surgery, that is the best. That means laparoscopic surgery is the best. And depending on their age and the other risk factors, we have to decide whether we are going to do the pelvic lymph node evaluation or not. That pelvic lymph node evaluation usually done by the gynae-oncologist. Once the general obstetrician and gynecologist detect womb cancer, they tend to get gynae-oncological opinion with regards to further evaluation. I think for each and every cancer, for staging purposes, we need the CT, chest, abdomen and pelvis. That is the radiological staging of the cancer. If we are going ahead with surgery for womb cancer, before to surgery we need to go through CT, chest, abdomen and pelvis to assess the spread of the disease. And whatever the stage, for example, the womb cancers can be staged into 1, 2, 3 and 4. 1 is confined to the womb. 2 is it is spreaded to the cervix. Stage 3 is the cancer go into the lymph nodes or cancer in that the abdominal or other structures. Stage 4, the cancer has developed into the other places such as omentum or the other upper abdominal structures or the liver or the lung, and that is stage 4. And these scenarios, what we can do is the womb cancer treatment, whatever the stage, is surgery is a must, because to relieve the symptoms we have to remove the womb. And depending on the stage, we decide whether there's a removal of the omentum. That means it's like a fat apron hanging in the bowel. We need to remove that also sometime, depending on the spread of the way the cancer is spreaded. Depending on that scenario, we might have to remove the lymph nodes also. And the problem with the womb cancer is people who are coming in late stage, they need chemoradiotherapy, as we discussed on the other day with regards to cervical cancer. In this womb cancer also, when they need radiotherapy, in Sri Lanka, because of lack of facilities, we have a bit of a waiting list. Chemotherapy can be done, but the radiotherapy, there is a waiting list.
Doctor, just as much as the fourth stage of womb cancers can spread to other organs in the body, supposing a woman has had a breast cancer, can she develop a womb cancer?
Yes, it's very common for patient with a cancer to get a second cancer.
Even male or female, right?
Yeah, whatever the sex, it is common. But especially with the breast cancer, which is called familial cancer syndrome, especially if they get a cancer in their early stage, that means early part of their life. That means if they get cancer less than 40 years of age or less than 50 years of age, they have a more high chance to develop a second cancer. Usually the second cancer can happen in the womb or the ovaries. Therefore, it's called breast cancer developed with the risk of BRCA gene. BRCA1 and 2 genes are there. If the mutation is BRCA1, then they tend to develop ovarian cancer also. The risk is high, about 28% risk is there to them to develop the womb cancer and the ovarian cancer.
And do you see patients in that situation?
Yes.
Do it.
And another thing they can do is people with breast cancer, especially they are getting selective estrogen receptor modulator drugs to suppress their breast cancer coming back, because breast cancer also linked with estrogen hormone. When they take medication to suppress the estrogen, they give usually tamoxifen. The tamoxifen has a stimulatory effect on endometrium, that means womb. They tend to develop womb cancer. Therefore, the oncologist, doctors who are treating the breast cancer, usually check with ultrasound scan the womb every 3 to 4 months usually. If the endometrial thickness is high, they tend to refer to a gynecologist to get an opinion whether this endometrium need to be assessed or not. Once they assess, if there's any abnormality, such as any abnormal cells or any cancer cell, then we tend to offer them hysterectomy. On the other hand, if they are having a family history of breast or the womb or the ovarian cancer, they can get prophylactic surgeries. That means removal of the womb on the ovaries prior to developing into cancer at an early stage if they are having a familial cancers. That is a very good option, because even though they are young, for example, BRCA1 gene mutation, if they are having that means if the family is having a very high number of patients with breast cancers and ovarian or the womb cancer, they can come and discuss with us the need for removal of their womb and ovaries before developing into a cancer. That is a very good option, which is called prophylactic surgeries.
A question that I'd like to go back to your talk the last time around on cervical cancer, and you spoke about the vaccination. Now, assuming the vaccination has been given, and that is, of course, to prevent cervical cancer. Yeah. And you had the doses, the 2 doses, or you said it can become 3 if they delay it. Just a question, doctor, if they have taken that vaccine, can that also serve as a preventive measure from getting womb cancer? No.
Womb cancer, it is not usually caused by a virus. The cervical cancer and the vaginal cancer and the vulval cancer are linked with human papilloma virus. But not the womb cancer. Womb cancer is usually due to unopposed action of estrogen hormone on the inner lining of the endometrium. So
even if that vaccination has been taken to prevent cervical cancer, the womb cancer can happen.
And that is 2 separate cancers we are talking about. Cervical cancer can be prevented with the vaccination, but not the womb cancer.
Thank you, Doctor. Just that I crossed my mind that are clear that, because listeners also might know, suppose we take this, can we be protected from that?
No,
we can't. Okay, thanks. So, Dr. Time has caught up with us. What is your take-home message?
With regards to womb cancer, what you can do is, if you are having abnormal bleeding, whatever your age is, whether it is less than 40 years or you are near 50 years of age or after the menopause also, if you are having any abnormality of your bleeding pattern, you need to come to a gynecologist and get yourself checked. That is the only way we can detect the cancer early. Other than the surgery, for precancerous stages, which is called hyperplasia, we can treat with levonorgestrel releasing intrauterine system, which is called Mirena. Therefore, not always we need hysterectomy to treat the precancers and womb cancer. Sometimes we can treat with medical management such as Mirena insertion in precancerous stages. And this cancer is very symptomatic. Therefore, be aware about yourself and take yourself into account and go to a gynecologist if you have abnormal uterine bleeding. That is my key message.
Thank you, Doctor. Good advice there, listeners. And on that note, we end this interesting discussion on womb cancers. And thank you very much, Dr. Kelum Jayasinghe, consultant gynecological oncologist, Teaching Hospital in Mahamudra, Galle, for being with us once again on the program and sharing your valuable insight with our listeners, this time around on womb cancers. Thank you, Doctor.
Thank you very much, Fatima.
Thank you too to Prabha Veerasurya for technical assistance, and Fatima Razikad bidding you good night and hoping you'll be with us next Monday same time on Views on Health.